The people who have been on the patient journey through the care pathways are the people who are best placed to describe what that journey felt like and to describe how perhaps it could be improved as well. And it is that perspective and insight which is so special and unique about working with experts by experience.
Working together, and in particular co-production, is so important. It's been invaluable, not just for the practitioners, but also for the people with lived experience who are carers, but also those experts by experience who have been using our services. And in that co-production process, everybody has learnt and has gained by that experience. And we've made a training, we've co-produced it, we co-deliver it, and it's been co-evaluated, has made it a much more richer and much more valuable piece of work.
Stronger Together it's a clinician and a carer together, modelling how to work together collaboratively and bring out the best in each other. We both have different knowledge and experience to share. And what we know is that the participants who come on the training really value that. When you bring everybody's perspective into the room at the beginning, you're much more likely to develop something that is relevant to the people it's designed for, and it's going to meet their needs.
Having the opportunity to work as an expert by experience has given me a lot. My confidence grew exponentially the more I was involved. Being afforded the opportunity to shape the future of the service has given me purpose and worth. It has given me a voice and a way of being heard, and whilst it's not always been plain sailing, I've developed strength and resilience through it. I've received encouragement and support when needed and feel part of the Together community.
I feel very grateful to be involved with the Together network because it really gives me an opportunity to express myself and my creativity in all sorts of ways. I feel like this network is a space where everybody is valued for their unique gifts that they bring.
Patient and carer involvement is key in improving our mental health, learning disability and neurodiversity services. Working collaboratively with service users, carers, families and our staff gives us a direct insight into what is working well, what's not working so well. It helps us discover examples of good practice where lessons can be learned and areas where improvements can be made. For me, the benefits of working together include service users and carers being able to suggest new ways of working, support staff recruitment and training, and raise important issues that really matter to people.
Working in learning disability services, we often support service users who have communication difficulties. It's essential that we involve the individual and their carers within everything that we do. By listening to families and carers, those that really know the individual the most, we can learn about what's really important for the individual.
We want to try and fully integrate volunteers and experts by experience as equal partners in the design and delivery of services.
Co-production and participation is about it being beneficial for the people with the lived experience, but also I think it's really important to remember that it's good for the service that they provide and offer credible, ethical and effective training. I think ultimately there's no point in doing training that isn't underpinned by those values.